There are many pregnancies around the world that all of a sudden become high-risk pregnancies, and many women have no idea what this actually means. In this video, I will explain why what I teach matters and the 5 main phases that a woman that's hospitalized with pregnancy will probably go through. Stay tuned. Hi there, my name is Iman, and on this channel I teach moms and their families all about their high-risk pregnancy and the NICU to decrease fear and increase confidence. Teaching and talking about high-risk pregnancies and being hospitalized with your pregnancy and having a premature baby are topics that are not really talked about anywhere. Most of us moms that have gone through it usually Google it when we're going through the experience. I feel like this topic is not really explained anywhere, especially on YouTube. And this is because most women who are pregnant usually don't go through this. They usually go full term and have full term babies. So most people are not really talking about it. But the women and the families that do go through high risk pregnancy and having a premature baby never forget it. It changes their life. So why what I teach matters is to let other women know and families know that they are not alone, and to provide a resource where they can learn and advocate for themselves and their baby. And this is why I do what I do. Before I start, this video is part of a 4-part series to teach moms all about their high-risk pregnancy and how to conquer being hospitalized with pregnancy. So check out the other videos in this series down in the description box. So if you like anything I said in this video, make sure you punch that like button and comment, because the more interaction I get with moms, the more moms this video can reach. So please, please, please make sure you like this video if it has helped you. So what is a high-risk pregnancy? If you're probably watching this, you're probably going through this yourself or know somebody in your family that's going through this. So it's a pregnancy where there is a risk present that increases your chance of having health problems or a premature baby. You are very closely monitored in a high-risk pregnancy just so your healthcare team can intervene if they see a problem. So this means all the regular tests that you would normally get as a pregnant woman would be increased. So more ultrasounds, more labs, more urine tests, more non-stress tests, just to keep a more close eye on you and your baby. Usually it takes one pregnancy that is high risk to make all your next pregnancies high risk as well. Even if your next pregnancies are going well and you're feeling well and no problem is found. For example, so for me, in my first pregnancy, I became high risk at 29 weeks when they found a placental problems. And I'll link that video somewhere in the cards or down in the description down below, where I talk about my crazy pregnancy story. And in my second pregnancy, I was high risk from the beginning and I was closely monitored. Even though everything went well and there's no problem seen and I went full term, I was still considered high risk with my next pregnancy. Why does a high risk pregnancy occur? So a woman might have some risk factors present, for example, like age or weight, that can make her high risk. And other times a woman might have no risk factor, might have a good pregnancy, and then a complication is seen later on. These pregnancies are very hard to explain why it became high risk. And this is exactly what happened to me. So if you have no risk factor present and you all of a sudden become high risk and are probably hospitalized, I would recommend talking with your own doctor and your own healthcare team about why they think you became high risk, because they know your situation the best and they know about your health history. When do you get diagnosed with a high risk pregnancy? So usually if you're a woman with no history or no health concerns, you would be diagnosed when the complication is seen in your pregnancy. If you do have risk factors present in your pregnancy, you would most likely be diagnosed with high risk pregnancy earlier on in your pregnancy. So it just depends on your health history. Every woman who have a high risk pregnancy have a premature baby. No, they don't. It is not guaranteed that if you have a high risk pregnancy that you will have a premature baby. Nothing is guaranteed, of course. The thing with the high risk pregnancy is if your complication is diagnosed early on in your pregnancy, you might be able to get treatment early on and be closely monitored, and hopefully you go full term. And this is what happened with me with my second pregnancy. I got my treatment very early. I had constant monitoring, and thank God I had a full-term baby at 39 weeks. But the thing is, once you are considered high risk, the chances of having a premature baby is just increased. Not guaranteed, but just increase, because the condition that made you high risk can cause a premature baby. I made a video on the 6 most common conditions that can cause a premature baby. Check it out. I'll link it up in the cards or down in the description box. The other question I always get is, why am I still considered high risk for my 2nd, 3rd, or 4th pregnancy? So I kind of talked about this already in my video, but like I said, once you have a high risk pregnancy, which means they see a complication in your pregnancy that might cause a premature baby, your next pregnancies, your healthcare team will be on high alert, because that condition that made you high risk might return for your next pregnancies. So just for the safety of you and your baby, all of your pregnancies will be considered high risk, just to make sure that condition does not return, or if it does return, you will get the best treatment to make sure your baby goes full term. So comment down below if you knew what a high risk pregnancy was before you became high risk. I obviously knew what a high risk pregnancy was when I got diagnosed because I'm a nurse, but I would love to hear about your experience. So once you have a diagnosis of a high risk pregnancy and your symptoms are worsening and your healthcare team is worried, then you will most likely be hospitalized on the antepartum unit of the hospital. So what is an antepartum unit? The antepartum unit is a unit of the hospital, usually close to the labor and delivery unit, where they monitor moms that are high risk very closely. So all the women on that unit are pregnant and their pregnancy is considered high risk. On that unit, you are closely monitored by nurses, by doctors, by ultrasound techs, and most of these women stay in the hospital until their baby is born. Do all women who have a high risk pregnancy get hospitalized? The answer is no, not all women. Usually pregnant women who have high risk pregnancy, they usually get hospitalized if their symptoms are worsening and their healthcare team is worried about them and their baby. Also, another reason why a pregnant woman would be hospitalized is if she needs emergent care right now. For example, her water breaking early and she needs that medical attention, then she would be hospitalized for the team to figure out what's going on. The other question I see is, how long does a woman stay in the hospital when they are hospitalized with pregnancy? So most women would stay in the hospital until they give birth. This birth would most likely be a preterm birth. The whole goal of being hospitalized with your pregnancy is to closely monitor you to keep you pregnant longer. The longer the baby is inside of you, the better they will do in the NICU. So in the antepartum, tests that are usually done are ultrasounds, and this is usually daily, lab tests, the non-stress tests, and also some women might be on complete bed rest. Comment down below if you are watching my video right now and you are currently in antepartum. Now we will go through the 5 main phases or events a woman that is hospitalized with pregnancy will go through. So number 1, you're diagnosed with a high risk pregnancy. So your doctor has seen a complication in one of your ultrasounds or one of your lab tests, and they are concerned for you and your baby's health. So you are considered high risk and you may be hospitalized with your pregnancy. So this can happen at the hospital after an emergency happened. For example, your water breaking early, or it can happen at your regular ultrasound appointment where a complication is seen. The second phase is you may be hospitalized with your pregnancy, or you might be able to go home and come back to be closely monitored. So this all depends on your condition and on your symptom. Some women, when the complication is seen, they need emergent medical attention right away. So these women are hospitalized right away and get the treatment they need. For example, for preeclampsia. Some women that are diagnosed with high-risk pregnancy might be able to go home and come back for a test. And this example is for a woman that has a UTI, so a uterine tract infection, and is having preterm contractions, and she's getting treatment with antibiotics. The third phase is continuous monitoring of you and your pregnancy to try to keep your baby in as long as possible. So this includes testing every day, possible bed rest, and in this phase, you are terrified. You feel like you are alone. You're usually in your hospital room, alone, isolated, terrified for you and your baby. You have just lots of emotional turmoil that you're going through when you are in this phase. And this leads to the fourth phase, which is the state of your mind when you are hospitalized with pregnancy. Oh, that isolation is hard. Hard. Any mom who's watching me and is hospitalized with their pregnancy right now, I know exactly how you feel. being alone, being isolated in your hospital room, the constant fear in your head of what's going to happen. And I actually made a special product just for you moms that are going through this right now. So just make sure you watch this video until the end for that. The fifth phase is the delivery of your baby. So if your symptoms cannot be controlled and your condition is getting worse, like I said, your baby will be delivered to protect them. And so I've always said that for our situations, me and you, it might be safer and better for our babies to be on the outside than the inside. Of course, the goal is to keep the baby in for as long as possible. If your baby's life is at risk, then your team will highly consider to deliver your baby. So I will talk about and explain all about hospitalization of a high-risk pregnancy in a special product I created. And I made this product to help other moms just like you, just like me, that are going through this crazy experience. So if you really want to know what this digital product that I created is, make sure you watch all the other videos down below in this series. I'm so excited for you to learn all about it and to see it, and hopefully it can help you. So check out the next video for the #1 advice I would give to any mom who's hospitalized with their pregnancy.